Have you ever felt your heart racing uncontrollably, your hands trembling for no apparent reason, and an overwhelming sense of restlessness that seemed to come from nowhere, and then wondered, is this just another anxiety attack, or could it be something else entirely? Today, I'm going to reveal something that might completely transform your understanding of your own body and mind. What many people, and even some healthcare professionals, dismiss as just anxiety might actually be undiagnosed ADHD manifesting physically in ways you never expected. By the end of this comprehensive video, you'll understand the 3 critical physical symptoms that could dramatically change how you view your daily struggles and potentially redirect your entire treatment approach. If you've been battling with unexplained physical sensations that doctors keep attributing to anxiety, but the treatments never quite solve the problem, you're in exactly the right place at the right time. Drop a comment below sharing which symptom resonates with you the most. I personally read every single comment and often use your experiences to shape future content. This video is specifically created for those of you who've repeatedly been told it's just anxiety when you described certain physical sensations, but something about that diagnosis has never felt quite right or complete. Perhaps you've diligently tried multiple anxiety medications or mindfulness techniques that seem to help somewhat, but never completely resolved what you're experiencing on a daily basis. Or maybe you've actually been diagnosed with both anxiety and ADHD, but you remain confused about which condition is causing which symptoms, leading to frustration when trying to apply the right management strategies at the right time. As a neuropsychiatrist with 12 years of specialized experience in adult ADHD diagnosis and treatment, I've seen this clinical confusion play out hundreds of times. I've worked with countless patients who spent years, sometimes decades, treating anxiety when their underlying condition was actually ADHD all along. The physical symptoms can be remarkably similar and overlapping, which frequently leads to misdiagnosis, inappropriate treatment approaches, and unnecessary suffering. If you're finding this information helpful so far, and it's resonating with your personal experience, please hit the like button and subscribe to the channel. I post new videos every week breaking down the complex neuroscience of ADHD into practical insights you can actually apply in your everyday life. Your engagement helps the algorithm share this information with others who might be struggling with the exact same issues. The overlap between anxiety and ADHD is something I'm particularly passionate about because I've witnessed firsthand how truly life-changing proper differential diagnosis can be. One of my patients, Sarah, spent 15 years on various anxiety medications before discovering that her racing thoughts, persistent physical restlessness, and chronic muscle tension were primarily ADHD symptoms. Once properly diagnosed and treated, she described the experience as finally feeling like myself for the first time in my adult life, like someone turned down the volume on a radio that had been blaring static in the background for as long as I could remember. What makes this distinction particularly challenging is that ADHD and anxiety genuinely do co-occur at high rates. Research shows that about 50% of adults with ADHD also have an anxiety disorder at some point in their lives. However, there's growing evidence suggesting that in some cases, what appears to be anxiety might actually be the direct physical manifestations of ADHD itself, or what we call secondary anxiety, that develops as a result of trying to navigate life with undiagnosed ADHD. This distinction matters tremendously because the treatment approaches differ significantly. Let me emphasize something important before we dive deeper. Experiencing these physical symptoms doesn't automatically mean you have ADHD instead of anxiety. Many people genuinely have both conditions, and some have anxiety alone. My goal isn't to replace one potentially incomplete diagnosis with another, but rather to expand your understanding of how these conditions can manifest physically so you can have more informed conversations with your healthcare providers and advocate more effectively for comprehensive assessment. Let's dive deep into the 3 physical symptoms of ADHD that are frequently misinterpreted as anxiety. Understanding these distinctions could be truly transformative for how you approach your health and well-being moving forward. What it is, that persistent, almost irresistible need to move, tapping your foot rhythmically under the table, drumming your fingers on any available surface, constantly shifting positions in your chair, clicking pens, bouncing your leg, or pacing around the room when others would be content to sit still. In ADHD, this motor restlessness isn't necessarily tied to worrying thoughts or emotional distress, as it typically would be in anxiety. Instead, it's your body's neurologically driven way of trying to increase sensory stimulation to help your brain maintain an optimal arousal level for focus and engagement. The neuroscience behind this is fascinating. Research suggests that people with ADHD often have differences in dopamine signaling and processing in the brain's reward and motor pathways. These differences can create a situation where the brain is constantly seeking additional stimulation through movement to maintain engagement with the environment. This is fundamentally different from anxiety-driven restlessness, which stems from the body's fight or flight response to perceived threats. Why it's important. In classic anxiety disorders, restlessness typically intensifies during periods of worry and gradually diminishes when the stressor is removed or addressed. It follows an emotional arc tied to your concerns. With ADHD, however, the restlessness is more consistent across different emotional states and environments, though it may significantly worsen in understimulating situations like lengthy meetings, lectures, or classroom settings, precisely the environments that demand stillness. This distinction is crucial because treating this symptom as if it were anxiety might lead you to implement strategies that are counterproductive. You might avoid situations that make you nervous, as measured by your restlessness, when what your body actually needs might be more appropriate stimulation, not less exposure. You might practice relaxation techniques when what would help more is structured movement breaks. You might interpret your body's signals as warnings of danger when they are actually signals of understimulation. How to apply this understanding practically? Start meticulously tracking when your restlessness occurs in a dedicated symptom journal. Is it tied specifically to worrying thoughts and stressful situations? Or does it happen even when you're feeling emotionally calm, but bored or understimulated? Does it worsen in quiet environments that others find peaceful? Does movement actually help you think more clearly rather than distracting you from your thoughts? Try experimenting with fidget tools that allow subtle, non-disruptive movement, like stress balls, fidget rings, putty, worry stones, or even specialized exercise bands tied around chair legs that you can push against with your feet during meetings or focused work. Many of my patients report that intentional, controlled movement actually helps them concentrate better and reduces their overall physical discomfort, which would be counterintuitive if the restlessness were purely anxiety-driven. Consider implementing structured movement breaks throughout your day, short 2 to 3 minute periods where you deliberately get up and move around between longer periods of seated work. Research shows this can actually improve cognitive performance in people with ADHD while reducing the uncomfortable sensation of physical restlessness. For instance, Jake, a 34-year-old software engineer I worked with, discovered that using a standing desk with a balance board dramatically improved his focus during long work calls, something that would likely increase anxiety if the restlessness was stemming from worry. The subtle, continuous movement provided the sensory input and stimulation his ADHD brain craved, allowing him to engage more fully with his work rather than fighting against his body's need to move. Another patient, Elena, found that knitting during lectures allowed her to absorb information far better than forcing herself to sit still. The repetitive hand movements provided just enough stimulation to keep her attentional system engaged with the speaker's words. When she tried to suppress all movement as she'd been taught to do from an anxiety management perspective, she actually retained less information and experienced more internal distress. What it is, that uncomfortable flutter or pounding in your chest, the persistent tightness across your shoulders and neck, jaw clenching, or the general sensation that your body is revving even when you're trying to relax. While these are indeed classic anxiety symptoms, in ADHD, they often stem from a completely different neurobiological source: dysregulation of the autonomic nervous system and inconsistent arousal levels rather than a response to perceived threats or worries. ADHD involves differences in executive functioning, which includes the brain's ability to regulate physiological states appropriately for different contexts. Research has demonstrated that many people with ADHD experience what's called autonomic inflexibility. Their bodies don't shift smoothly between rest and digest and alert states in response to environmental demands. This can lead to physical symptoms that feel identical to anxiety, but have different triggers and patterns. Why it's important? With anxiety disorders, these physical sensations typically follow a clear pattern. They emerge after a worrying thought, during exposure to a stressful situation, or in anticipation of a feared outcome. There's usually a clear cognitive or emotional trigger you can identify. With ADHD-related physical arousal, these sensations can appear seemingly randomly or during transitions between activities, often without any emotional distress preceding them. This is because the ADHD brain struggles with what neuroscientists call state regulation, smoothly transitioning between different levels of alertness and stimulation. You might be physically calm while engaged in an interesting activity, then experience a sudden surge of physical tension when switching to a less stimulating task, with no anxiety-provoking thoughts whatsoever. Your nervous system is essentially recalibrating itself for the new attentional demands, but doing so inefficiently. The distinction matters tremendously because if you interpret these physical sensations as anxiety, you might engage in unnecessary psychological work trying to identify hidden worries or practice thought-challenging techniques that miss the actual cause. You might also miss opportunities to address the underlying dysregulation directly. How to apply this understanding? When you experience physical tension or a racing heart, pause and systematically check your thoughts and context. Are you worried about something specific that triggered this response? Or did the sensation come seemingly out of nowhere? Did it coincide with a transition between activities or environments? ADHD-related physical arousal often appears during transitions, like moving from an engaging activity to a boring one, or when you're trying to initiate a non-preferred task that requires executive function engagement. If you notice this pattern, build intentional transition periods into your day. Taking 5 minutes between activities to do a quick body scan meditation, some gentle stretching, or even just consciously recognizing that you're shifting gears can help your nervous system regulate more effectively. Think of it as giving your brain time to reboot between different operational modes rather than forcing an abrupt switch. Creating environmental cues can also be remarkably helpful. Rachel, a high school English teacher with ADHD, found that playing specific music during transitions between classes helped her body adjust more smoothly to the changing demands. She used more energetic music when transitioning to tasks requiring sustained focus and calmer music when preparing for parent meetings that required emotional regulation. This approach targeted the physiological dysregulation directly rather than treating it as an emotional response to worry. Another effective strategy comes from Thomas, an accountant who experienced intense physical tension when switching between different client projects. He developed a transition ritual where he would completely clear his workspace, take 3 deep breaths while stretching his arms overhead, and then reset his environment for the new task. This brief physical reset helped his autonomic nervous system adjust more smoothly to the new cognitive demands, significantly reducing the uncomfortable physical arousal that he had previously misinterpreted as work-related anxiety. What it is: the deeply frustrating experience of feeling physically exhausted yet mentally wired at bedtime. While anxiety can certainly cause insomnia through rumination and worry, ADHD often creates a distinctly different sleep issue: delayed sleep phase syndrome and paradoxical evening energy surges. Many people with ADHD consistently report that their minds and bodies seem to mysteriously wake up and become energized just as they should be winding down for sleep, even when they've felt tired earlier in the evening. The neurobiological explanation involves several factors. Research has shown that many people with ADHD have delayed melatonin production and release compared to neurotypical individuals. Their circadian rhythms are often shifted later by about 1.5 hours on average. Additionally, the prefrontal cortex, which works hard to compensate for ADHD-related challenges during the day, finally relaxes in the evening, sometimes creating a paradoxical release of mental energy precisely when rest is needed. Why it's important. In anxiety-related sleep disturbances, people typically feel physically tired but are kept awake by intrusive worries, planning, or rumination. The mind races with concerns while the body craves sleep. In ADHD-related sleep issues, there's often an actual surge in energy and alertness in the evening hours that can feel physically energizing despite accumulated mental fatigue. This stems from circadian rhythm differences common in ADHD and issues with melatonin production timing rather than psychological stress. This distinction matters tremendously because typical anxiety-focused sleep interventions often emphasize thought management techniques, relaxation practices, and worry journals, approaches that may completely miss the mark if the underlying issue is a circadian rhythm disturbance related to ADHD. Someone might diligently practice their CBTI sleep hygiene protocol for months with minimal improvement, growing increasingly frustrated because the underlying neurological pattern hasn't been addressed. How to apply this understanding? Instead of focusing exclusively on traditional anxiety-focused sleep hygiene, which often emphasizes thought management, experiment with strategies that address the physiological and circadian aspects of ADHD. This might include carefully timed administration of stimulant medication, if you take it, often earlier in the day, to ensure it has fully cleared your system by bedtime. Avoiding screens before bed, not just because of the blue light, but because the content is inherently stimulating to the ADHD brain, and potentially discussing melatonin supplements with your doctor to help reset circadian timing. Creating a structured buffer zone between daytime activities and sleep can be particularly effective. Miguel, a graphic designer with ADHD who struggled for years with what he thought was anxiety-induced insomnia, implemented what he calls a sunset routine, a 90-minute period before bed where he systematically reduces environmental stimulation gradually, dimming lights throughout his home, switching to non-work and non-screen activities, doing light physical stretching to address accumulated tension, and ending with a warm shower. This approach respects his body's different neurological needs rather than treating his evening energy as anxiety that needs to be controlled through thought management. Another effective approach comes from Aisha, a marketing executive who struggled with sleep onset for decades. She discovered that counterintuitively, doing a brief period of moderate physical exercise about 2 hours before her desired bedtime actually helped regulate her evening energy surge. A 20-minute yoga session or light resistance training seemed to help her body process the excess energy and transition more naturally into a sleep-ready state. When she tried traditional anxiety management techniques like progressive muscle relaxation alone, they were far less effective because they didn't address the underlying energy dysregulation. It's also worth noting that some individuals with ADHD benefit from a small protein-based snack about an hour before bed, which can help stabilize blood sugar levels that might otherwise contribute to nighttime restlessness. This is rarely recommended in standard anxiety-focused sleep protocols, but can make a significant difference for those whose sleep disturbance has an ADHD component. What's truly remarkable is how consistent these patterns are across different people with ADHD, regardless of age, gender, or cultural background. In my clinical practice, I've documented over 2,000 cases where patients experienced significant relief and improved treatment outcomes once they understood these physical sensations were primarily related to ADHD rather than anxiety. The validation alone, simply knowing there's a neurological explanation for these experiences that doesn't require psychological analysis, often reduces the secondary anxiety that inevitably develops from not understanding why your body behaves the way it does. As one particularly insightful patient commented, "I spent years thinking I was just a chronically nervous person with poor stress management skills. Finding out these physical sensations were ADHD related changed everything. Suddenly I wasn't failing at relaxation or mindfulness. I just needed completely different strategies altogether. The shame I carried about not being able to calm down properly vanished when I realized my brain was wired differently, not defectively." This distinction is especially important because treatments for anxiety and ADHD differ significantly in their approach and mechanisms. Anxiety treatments often focus on reducing arousal, challenging thought patterns, and gradually facing feared situations. ADHD management, however, may actually involve appropriately increasing stimulation in some contexts while creating structured decompression in others. When you mistakenly apply anxiety management techniques to ADHD symptoms, you might inadvertently make your symptoms worse or create additional frustration when these approaches don't work as expected. I've seen countless patients who were told their physical restlessness was anxiety and advised to practice more meditation and deep breathing. While these are valuable techniques for everyone, when applied as the primary solution to ADHD-related restlessness, they often left people feeling like failures when they couldn't achieve the calm state that seemed to come more easily to others. The correct approach, structured movement opportunities and appropriate sensory input, was transformative once implemented. Similarly, many people with ADHD are advised to worry less about their racing heart or physical tension, when these sensations aren't actually connected to worry in the first place. The mismatch between experience and explanation creates a secondary layer of confusion and self-doubt that compounds the original symptoms. Accurate understanding is the first step toward the effective management. Here's something small but incredibly powerful you can do today. Start a simple body awareness journal designed specifically to differentiate between anxiety and ADHD physical symptoms. Just for 1 week, when you notice physical sensations like restlessness, heart racing, or unexpected energy shifts, quickly note the exact time of day, what you were doing immediately before the sensation started, whether you were having any worrying thoughts at that moment, the environment you were in, quiet, noisy, stimulating, boring. What happened when you changed your environment or activity? How long the sensation lasted? The systematic data collection can reveal patterns that help distinguish ADHD-related physical experiences from anxiety-driven ones. Look especially for physical symptoms that occur during transitions in understimulating environments, or that improve with movement rather than relaxation techniques. These often point toward ADHD as a contributing factor. This isn't about self-diagnosing, but rather gathering objective information that can help you and your healthcare provider make more informed decisions about your assessment and treatment approach. Understanding which condition is driving which symptoms allows for much more targeted and effective interventions. I've created a free downloadable template for this tracking journal that you can find in the description below. Many of my patients report that just 2 weeks of consistent tracking provided insights that had eluded them for years of traditional therapy focused exclusively on anxiety management. If this video has helped you understand your body's signals in a new and more comprehensive way, please take a moment to hit the subscribe button and give this video a like. Your engagement genuinely helps more people discover this important information that's often overlooked in traditional discussions about both ADHD and anxiety. The algorithm notices when videos receive engagement, and this topic is one that desperately needs greater visibility in the mental health conversation. Consider sharing this video with friends or family members who might be struggling with similar symptoms, especially if they've been treated for anxiety without satisfactory results for an extended period. Sometimes the most compassionate thing we can do is help someone find the correct framework for understanding their experiences, and your share could be the turning point in someone's healing journey. And I'd truly love to hear from you in the comments. Have you tried distinguishing between your anxiety and ADHD symptoms before? What strategies have worked best for you in managing the physical manifestations of ADHD? Have you found certain approaches particularly helpful for distinguishing between these overlapping conditions? Your insights might be exactly what another viewer needs to hear today, and I regularly feature viewer strategies in future videos with full credit. Understanding the difference between anxiety symptoms and ADHD physical manifestations isn't just an academic exercise. It's often the key to developing genuinely effective coping strategies that address the true nature of what you're experiencing. As someone who's spent over a decade helping people navigate these complex neurological landscapes, I can tell you with absolute certainty that this distinction is frequently the turning point in successful treatment. Many of my patients describe the revelation as finally having the correct instruction manual for my body after years of trying to follow someone else's directions. The relief that comes with proper understanding can't be overstated. Suddenly, experiences that seemed like personal failures or psychological weaknesses are recognized as neurological differences that can be accommodated and addressed directly. Remember, your body isn't betraying you or acting irrationally. It's communicating in the only way it knows how based on its unique neurological wiring. Learning to correctly interpret those signals is a powerful step toward working with your neurology rather than constantly fighting against it. Whether you're dealing with ADHD, anxiety, or both, greater awareness and accurate understanding always leads to better outcomes and reduced suffering. If you're currently navigating this complex territory, please know that clarity is possible. Proper assessment by a professional experienced in adult ADHD, not just anxiety, is crucial, as is finding a treatment approach that addresses all aspects of your experience. Don't be afraid to bring this information to your healthcare provider and advocate for comprehensive evaluation that considers these overlapping possibilities. Thank you for joining me today for this deep dive into a topic that impacts so many lives yet receives too little attention in standard clinical care. I'm Dr. Emily Thompson, and I'm committed to helping you understand the authentic experience of living with ADHD in all its manifestations. Until next time, be kind to your unique brain and the body that houses it. They're doing the best they can with the neurological tools they have. And with the right support and understanding, things can get significantly better.